Hello, everyone. This is Dr. Joanna Yamamoto, and I'm here with my dad and my colleague, Dr. Joe Yamamoto. And we are showing this webinar in partnership with Heilen. And basically, today we want to talk about what metabolic diseases are and how these metabolic diseases um, could put you at risk for COVID-19. So, actually, a lot of people have been reaching out and inquiring in Highland's Facebook page, um, asking about the services. And uh, my dad and I are actually functional medicine practitioners. And a few of those that were asking were actually wondering exactly what functional medicine is. So, Dr. Joe, Dad, can you tell us a little bit about what functional medicine is?
Okay, so functional medicine is not really a new branch, but it's a new way of looking at medicine. So compared to allopathic medicine, which is the standard way of doing things, what you're trying to really do is allow the people to understand a systems biology approach, meaning to say the resolution to our medical problems is not anymore, it's not adding so many more pharmaceutical drugs, but it's really making sure that the patient understands that in the body there are actually response mechanisms and protective mechanisms that can leverage about health. So in a nutshell, for people to understand, very simple, preventive functional medicine is really more like root cause medicine. In short, you are helping people, patients for that matter, to understand the root causes of their illnesses. Because if you know the root causes, then you will know the solution.
Mhm.
And in another way, for people to understand this is that consider the symptoms or the manifestations that are observed or felt by the patients are essentially called downstream. Means it is already the effect of the body responding to factors. So whatever symptoms that you feel, you can label that comfortably as downstream. And so what functional medicine allows us, the doctors, including the patients, to understand is searching for the upstream. In short, the causes. What causes the patient's manifestations and what are in the upstream that causes the patient to manifest as chronic diseases. For people to understand as well, the approach to functional medicine cannot be one solution for everybody. It must be personalized. The patient is the center of our attention. It is physician directed, and at the same time, it is predicted. Meaning to say, if you do this, expect the following. So it's predictive in that definition, short and focused definition.
Um, that's actually a very good explanation. Something bite-sized, so to speak, that people can at least get an idea of what it is we try to do with functional medicine. So I mean, it really highlights the fact that our body has a natural ability to heal itself, and of course, um, everything that we are, our health and our wellness is really tailored to the individual. And what I like about functional medicine, especially what you mentioned that it's physician directed and you work with the patient, is that we also work with a team of other healthcare professionals in what we call a collaborative care team approach. That way, we are able to offer all the support uh, that patients would need, whether it is in the form of other professionals or it is in the form of other interventions. Okay, so going back to the main topic of our webinar today, um, we've heard in the news and from experts that those that have metabolic diseases like heart disease, diabetes, what else? Perhaps autoimmune conditions and the like are actually more at risk for COVID-19, which is why we kind of flag people with these conditions as vulnerable, more vulnerable in terms of actually catching COVID-19. So can you tell us a little bit about why probably these metabolic conditions increase the risk?
Before I go to that question, I'd like to define perhaps certain things, or rather emphasize certain things about the COVID pandemic. One is that we cannot rely at this point on vaccines, because vaccines are easily into the distant future. You're easily looking at 12 to 18 months at the shortest before you can have a set of vaccines that will probably be tried, tested, and then validated with scientific data and real experience on human patients. And at the same time, at this point, because we're seeing the possibility that this case are going to continue a little longer, is that there is really no magic bullet. There's no magic bullet for COVID. And therefore, that said, we can always say that in the arsenal of the medical world, there is nothing that is specifically targeting COVID virus. But what we can have is emphasize certain facts as well, and that is really from the data, from the results and the experience of the world, is that those people, regardless of your whether you're male or female or age, so long and provided you have metabolic disorders represented mainly by hypertension, diabetes, and obesity, these are in all likelihood the patients who are susceptible to and vulnerable to the entry of the viruses, and where the viruses can take root and manifest itself. Either you're asymptomatic or worse, you can become ill, and sometimes to the whole spectrum of being seriously ill, including those that finally lose their lives. So it's really hypertension, diabetes, and obesity, and I think that this is going to be a very important aspect of our discussion today.
Mm-hmm. Mm-hmm. Yeah. And I think the important takeaway there is that because in functional medicine we know that each of us has an individualized state of health, and we all have different factors that come into play that actually contribute to where we are in terms of our health status. So my question is, how come those that have these metabolic imbalances, those that have the three that you mentioned, hypertension, obesity, and diabetes, how come they are more at risk for COVID-19? What is it about, any perhaps metabolic derangements that they have that actually puts them more at risk?
The metabolic problem are mainly represented by imbalances within the body. And those imbalances, whether you're talking about hormonal or even the basic nutrients in the body, or even, for example, as critically important as the sugar metabolism, that can actually result not only in many illnesses. I say many because it's not just about diabetes. And considering that at the root of it all is that whether you're diabetic or not, or pre-diabetic or not, then there's a great likelihood that you will be affected by coronavirus or COVID. And the metabolic imbalance represented by sugar metabolism, or even immune dysregulation, or even, for example, deficiencies of critical nutrients, or even excess of unwanted substances in the body, can result in metabolic dysregulation. So when you talk about metabolism, it's the interplay not only of the nutrients, but also of the various hormonal system. And any hormonal system, while it may be complicated to discuss, is that the most important example of vulnerability to COVID are really those patients who have diabetes. And more often than not, patients with diabetes, or even the so-called pre-diabetic, are hypertensive, and most of them are also obesity. In point of fact, obesity is a manifestation of a metabolic imbalance, and therefore a metabolic dysfunction. And if you have a metabolic dysfunction, at the root of our primary defense, if you try to sum up everything, is really our immune system. And if the immune system is strong, obviously you are protected. But hypertension, diabetes, obesity have so many ways can disrupt your balance in the immune system. For example, this situation can actually make it possible that there is inflammation. Viruses essentially cannot penetrate or affect cells that are normal. But if on account of the metabolic dysregulation or imbalance, you will have cells that are inflamed, starting with those in the nose, in the mouth, the upper respiratory, and the lower respiratory tract. Inflammation makes them conducive to the penetration of the viral particles. And so the metabolic dysregulation also can also see a manifestation whereby the patient's immune defense system, the first line of defense being a strong barriers. The barriers represented by the skin and by the cells lining the nose, the mouth, the eyes, the upper and lower respiratory tract, including the intestines, are your primary line of defense. And then if in case that the primary line of defense has been breached, then it is the immune cells, the immune defense system that mobilizes in so many ways its form to attack the agents, viruses or bacteria that enters. But if you have a metabolic dysregulation or a metabolic imbalance, like here we're talking about diabetes, patients with diabetes will have elevated blood sugar, but not only elevated blood sugar, but they have also intolerance. If you have an intolerance and you have a spillover of excess sugar in the bloodstream and in the tissues, it can actually damage not only your cells, causing free radical damage, which free radical damage, by the way, can contribute to perpetuation of inflammation. But at the same time, the free radical damage can ensure that and then the elevated sugar as it is can have a way of immobilizing. In short, the responsiveness of your immune cells are actually slowed down, if not stopped, during the time that you have elevated sugar in the environment or in your bloodstream. And so you can just imagine when people have immune dysregulation or especially sugar imbalances, and if all your meals are high in blood sugar or that elevates your blood sugar, so you are actually seeing the real possibility that your immune cells, mainly your white blood cells, are repeatedly immobilized. Hence, your ability to resist entry, penetration by viruses and even bacteria are really compromised.
Wow, that's a lot to take in, but I think it's the kind of information that we all need to keep in mind, especially right now. Just going back to when you mentioned that functional medicine is really systems biology, it sounds like some of the root causes potentially that someone with a metabolic imbalance has. It's all interconnected, no? Parang somebody who has metabolic dysfunction, no, in the form of, say, for example, hypertension, diabetes, and obesity, will more or less have a problem with inflammation and consequently a problem with the immune response. And it sounds like the one of the biggest players there is really nutrition. No, if you have a deficiency in some nutrients, probably that support a good immune defense system. The first line you mentioned is the barrier, and the next line really is your immune cells, or an excess of the things that might impair a good immune response, such as excess sugar in the diet. Can we then safely say that what we choose to eat, or maybe even what behaviors we have, uh, can contribute to, one, to these metabolic imbalances, and of course, two, to the inflammation and the immune dysregulation that puts us at risk for COVID-19.
Okay. Having mentioned metabolic dysregulation, inflammation, and its interplay with free radicals, I hope that the concept is at least familiar to people, even if they do not fully understand it. But at the very least, key words here are really free radicals and antioxidants. Then we have, of course, the immune dysregulation and metabolic imbalance. What I would like to introduce is the idea that the first intervention that you would probably like to share with people, with the public out there, is that the first thing, if there is one single step that you would like to do that has an immense contribution to improving your health, it is really removing excess sugar. Why? Because sugar is addictive, and precisely the reason why many people are have an increased urging to eat sugary foods or refined foods or even processed food is because all processed food mainly are loaded with excess sugar in all its forms, including perhaps the synthetic high fructose corn syrup, which can contribute to a lot. If sugar is already sweet, the high fructose corn syrup is even sweeter and even more metabolically disruptive. That is why our first advice to people in terms of trying to improve the equation and improve your odds of resisting COVID infection is remove sugar. I'm not saying entirely all the sugar, but cut down sugar to the barest minimum. There are many alternatives out there. And if you simply change and remove sugar in all its form. By the way, here I would like to take the liberty of saying refined carbohydrates, the so-called white carbohydrates as white sugar, white potato, white flour, including its bread, etc. They are all refined carbohydrates, and when you take it, in not too long later, it will actually become sugar, glucose in the bloodstream that can drive your blood sugar up with all its consequences, perpetuating sugar addiction. And so if you simply remove it, your sugar cravings come down, and then with the net effect that inflammation comes down, including the sugar cravings come down. In short, even your imbalance of hormone, namely insulin, also comes down. Without you going or embarking on a deliberate weight loss program, when inflammation is down, your sugar is down, you can actually start seeing improvement in your metabolism manifested by what? What is desirable in terms of weight loss. And so, how do you replace sugar, refined carbohydrate, sugar, or refined carbohydrate? Change it with complex carbohydrate. Your body needs the complex carbohydrate represented by green leafy vegetables. Green leafy vegetables and fruits that are relatively low in sugar composition. So if you will just replace your refined sugar with complex carbohydrates represented mainly by your vegetables that are not only good and balanced, but at the same time, they are nutrient rich. Sometimes or many a times when you eat vegetables and fruits, your vitamins, your essential vitamins are already there. Okay? So at this start, you have an option. And then, of course, the other parts of the balanced meal or balanced diet is really lean proteins, meaning to say proteins that are planned to not only to preserve and maintain your immune system, but also planned so that your muscle mass, which is very important to keep you moving and also moving your breathing, etc., are there. And finally, of course, a healthy dose or increased dose of healthy fats, mainly, for example, your virgin coconut oil, virgin olive oil, avocado fruits, and also grass-fed meat. Although, of course, I understand that grass-fed meat and the fat thereof are rather expensive, but there are other options represented by that you can easily access virgin coconut oil.
Mm-hmm. Mm-hmm. Yeah. I mean, I think, the main point to take away there is that really what we choose to eat, um, plays a huge factor in whether or not uh, we can minimize the risk for COVID-19, or probably to make our immune system more resilient. And I think, if we can all choose to consume a more nutrient dense meal, no? Just begin with one and then try to keep doing that with all of the meals that you have. That already is a good step in, one, trying to make your immune system more resilient, and two, of course, trying to bring down any metabolic imbalance that you might have. And I think the good thing there is that you're not only addressing something, no, meaning to say you're not only trying to fortify your immune system or make your immune system more resilient. You're also, trying to take a step uh, towards a more balanced and healthy lifestyle. No? Kumbaga, hindi lang siya something to fight against the COVID-19 pandemic, but really something to help us fight against the pandemic of chronic disease, right?
Yeah, that's right. That's right.
Mm.
And
And
having spoken about diet, of course, this webinar is relatively short to talk about the full spectrum of diet. That can be probably another topic. But at this point, talking about lifestyle, I don't want to make it so complicated, except that you make sure that you are able to sleep like 7 to 8 hours of restful evening sleep, because that alone can already help tremendously in balancing your hormones that can actually are contributory and imbalance in the hormones, especially your cortisol or stress hormones, can actually already regularize your blood sugar and also help in controlling other imbalances. So that alone has already a measurable effect on in actually improving you and making your immune system resilient.
right, right. Um, I think it's become our culture, not just in the Philippines, no, but everywhere in the world, where you kind of push aside sleep, even among us, no, tayo mga practitioners, especially as doctors, training in med school and going through yung mga duty, we actually lower yung priority ng sleep, but what sometimes we forget that it's absolutely essential to restoring balance and trying to achieve optimal health and wellness. And siguro the other lifestyle factors that we need to highlight and to focus on really is our response to stress, no, first and foremost, and how we are able to, I wouldn't say manage, but really how we choose to transform that. It's very very important kasi yun nga, no, yung stress just perpetuates yung cycle na to. It makes you, generally speaking, more inflammatory, and consequently leads to metabolic dysfunction, leads to immune dysregulation. And so very, very important yan. And this is why, we are lucky at Heilen to work with such wonderful practitioners, our health coaches, and other practitioners, the other doctors that can also help us, find a way to positively transform stress. And kasi nowadays naman, it's okay. It's okay to be stressed. It's okay to be anxious. It's okay to be fearful. And the other very, very important thing that we need to focus on is yung mga relationships natin, or the sense of being connected, connected and aware sa sarili mo, being connected to, people you love and care for, and just being connected to God and your spirituality, and just finding a community of like-minded individuals, that can provide support um, throughout yung journey, especially ngayon, no, during this COVID-19 crisis. So I mean, those are just uh, some of the tips, no, that points towards the importance of lifestyle factors um, to help make our immune system more resilient and to help address metabolic problems. Um, while it is, you know, difficult to make all these changes ng sabay-sabay, we just want to provide reassurance that it's okay na hindi mo siya isang bagsakan i-apply sa sarili mo, ano? Unti-untiin mo, and this is why practitioners like us and some of the other members of the collaborative care team are there to offer our support. Kasi this approach naman, no, when you choose to make that change, when you choose to actually begin your journey towards health and wellness, we're here to support you. We're here to journey with you. Kasi nga, hindi naman siya madali. Siguro, can we, before we wrap up, I know that Heilen has a lot of interventions and services to offer. No? Personally, we've tried a lot of the services that they offered. Is there something or a few things that you would like to recommend specifically to help make our immune system more resilient?
Okay, so I guess there's so much to be said. Most of the time, contributory in terms of our health journey is the following. There's such thing as two things about either deficiency or excess. So I'd like to highlight the following: deficiency of the essential and vital nutrients, whether it's vitamins, minerals, antioxidants, phytonutrients. Still, there is deficiency. Just keep in mind that while you are going to eat or embark on eating natural and real foods or even organic foods, the nutrient contents, whether it's vitamins and minerals, are determined pretty much by the nutrient contents that is in relation to the quality of the soil. I think it's very important also to highlight that the quality of the soil nowadays, wherever you go, is not of the same level and quality as it did before. Remember that plants, vegetables, and fruits will get their nutrients from the soil. So if the soil is nutrient deficient, even if you have fresh vegetables and fruits, there will be there will be lack of the essential minerals and nutrients. Therefore, that probably opens the reality or possibility of supplementing. In my practice, we have actually seen to it that I have yet to see a patient that does not have a supplement, but supplements cannot actually supplant or cannot be a replacement to a bad diet. So always start with diet and good lifestyle. And that said, we talk about what are the things that we are able to offer, especially in the time of this COVID pandemic. There are, for example, services that are probably available in Heilen. Like, for example, it's an IV vitamin C therapy. Very important in highlighting that IV vitamin C has been demonstrated repeatedly. There is science out there, and there are actually a lot of papers that have come out in the role of vitamin C in fighting or increasing the resiliency of your immune defense system. In point of fact, there are already papers that have come out not only in China because of this COVID pandemic, China, in Europe, and even the US, United States. There are actually hospitals that have added vitamin C as part of their armamentarium in responding to the COVID pandemic, especially those patients who have taken ill, especially those who have been hospitalized. So the important thing is that if you would recommend IV vitamin C, it must not be it must be early on. In short, the threshold for recommending IV vitamin C should be that you should access that without having to to debate whether you want to have it or not, or to use it or not. But the science is already there. The other thing that we probably highlight, there are actually other multiple combinations of nutrients that our colleague in Heilen are able to offer. But there is a technology that, for example, listening to the webinars of the experts in the US, those that are functional medicine practitioners have also highlighted the importance and contribution of ozone therapy, and then also the hyperbaric oxygen. So these are things that are available in Heilen, and it would be probably wise not to disregard them. not to ignore them because there is science in their utilization. So I will not probably have the opportunity to expand on the hyperbaric oxygen therapy or even the ozone therapy. But nevertheless, perhaps in another episode of this webinar, we'll be able to expound on the value and contributions of those. Remember, they do not replace a good immune defense system. But very important that there are, just to know that there are augmenting or complementing strategies that can help one person's journey towards health and wellness.
All right, great, that's good. Yeah, so I guess before we wrap up, we just want to share to our viewers out there that if you have any other questions, about the topic that we shared today, or any questions about the services and interventions that Heilen is offering, please don't hesitate to reach out via their Facebook page or through the number. You can also find it in their website or on the Facebook page, if I'm not mistaken. And if you're interested in working with us or with any of the practitioners at Heilen, please also do send an inquiry. I know that we're offering online consultation. And then if you would like to interact with us or follow us or just say hello, we're quite active in our social media accounts. It's Dr. J Yamamoto. We have a Facebook page and Instagram. Or just if you want to know more about us, don't be afraid to reach out via the Heilen Facebook page. Any other thoughts or last tips, then?
Well, I guess what I'd like to tell people is that we cannot totally delegate our health to authorities, whether you're a doctor out there or the government. It's not their main responsibility to talk about our health. So if you're going to really want to make a meaningful contribution to how you're going to respond not only to COVID, but at the same time future threats, is really making sure that you commit to make yourself healthy and well. And that is where perhaps our team, you and I, and then the rest of the doctor partners and the healthcare providers in Heilen can contribute. And just for the people to be assured that for your health needs, for your health advice, we are there to help you.
All right, sounds good. Yeah, so please stay in tune. There are a lot of other interesting topics that will be discussed in the Heilen series of webinars. Yeah, I guess we just want to say thank you to everyone at Heilen for giving us the opportunity to share our thoughts. All right, that's it, everyone. Stay safe and see you soon.